Hey, welcome people of Earth to another edition of the Two Aliens podcast. I'm joined by my co-host and my good friend Nabil, who's probably social distancing himself in some remote part of the world. One of the reasons why we haven't been able to do the podcast more frequently is because we've moved to two different countries and it was getting a bit complicated with all the work and you know how the world is right now. I mean, I don't have to tell you, but Nabil, who's a doctor, he'll probably give you some good info about the origins of the virus and where we stand and what's the outlook. So, first of all, how have you been, Nabil?
Hey, Naman, thank you for I'm good. I'm good, really good. But I also want to say that I'm sorry, folks. We couldn't release any content to you all because as Naman was mentioning the reasons. So yeah, but now from now onwards, hopefully we are back and we will be releasing more content to you guys. And as Numan was saying about the coronavirus, yeah, and it's been a tough month, you can say. It's been like a more than a month now for on my side that we have been going through this whole scenario, and I gotta say that the future it's kind of looking bleak for us in Oman. The reason being, as everybody knows, there's no vaccine at the moment, and I was talking with my colleagues and my friends, and most of us are saying that the possibility, the chances are that by the end of this year or maybe next year, maybe the vaccine might come. But then the issue is how can we manage this whole pandemic scenario? And talking about the origin issue,
Let's start from the beginning. It started from China in Wuhan, right?
exactly,
Wuhan in China.
exactly. So basically, pneumonia started in last year in November, but
Okay.
the issue was that the cases were going up in Wuhan, but the Chinese Communist Party wasn't releasing the information to the public in general. I mean, the international media about it, and they were trying to cover it up. And you can understand the scenario by this kind of situation when the doctors in Wuhan were complaining about this unknown cases rising up in the hospitals. In terms of people are coming in sick, the symptoms are the same, like similar to the seasonal flu, but the rapid, you can say, downfall of the health of a person in such a short duration of time is shocking because a person is undergoing what you call shortness of breath.
So tell me, how is it different from the common cold and influenza? How is it different from both of these?
Yeah, I was gonna tell you, Nawan. The thing is, there's not much difference actually, because the seasonal flu and the coronavirus in the beginning, the symptoms when they show up, it's like fever, cough, and shortness of breath. In some people, and in rare cases, you can even have GI problems, meaning diarrhea issues. But still, the only difference you can say between the influenza virus or the seasonal virus and the coronavirus is the incubation period. And the incubation period is basically the time period from when you get infected to the time when you start showing your symptoms. So the incubation period of coronavirus is sometimes like 7 days or 14 days, or even there are some physicians telling us that in some countries the patients are showing 24 days time period of incubation. So that's the biggest
Wow.
difference. Exactly, yeah, it is a big difference. And you might be walking outside, but you might feel okay, but you never know. You could be an undiagnosed asymptomatic carrier of the virus. So that is the scary part. In terms of influenza or the seasonal flu, which you can say is the incubation period is very short, and even the rate of transmission, meaning from person to person, is also low. But in terms of
Okay, but how did it all start? Because from the things I've read so far, coronavirus used to be only between animals, right? So how did it transmit or transfer to human beings?
Yeah, this is a good question you asked. The thing is basically, you are right. It used to be only between animals in beginning, but now, as we're talking about China. If people know about this, that there's a huge consumption, there's a huge market of um, eating wildlife animals over there, and there are specific places called wet markets, And in these wet markets, basically, if you have seen the pictures, they are cages, and in these cages, there are animals stacked up. And the problem arises is that the hygiene is the issue. The people who are selling these animals, they are not like keeping those places clean, and the way they have stacked up the animals, the cages, there is no like covering up of them, meaning the excrement is coming out from the top of the cage, like the animal cage is in the top. So if the animal excrete is like taking a dump or something, it falls under the cage which is below one. And suppose there's a chicken below that one, treatment falls down under the ones below the animals, and there are different animals living in like small areas and small places. So the guys who are working over there, they don't clean them up properly, and the dirt or the excrement mixes up with the food which they are feeding to the animals. The next thing you know is the animal is the one below under the cage is also eating that same stuff. So the dirt and the excrement and everything mixes up with the diet of the animals, and then on the long run, it doesn't take like maybe days, but it takes like months, so or even years. And then in this slowly you will witness a change. And what happens is that the virus slowly starts spreading out through the fecal oral matter transmission method. And the next thing you know is it enters into another animal. For example, from if it was in the bat, the next thing is through excrement it will enter into a cat or a pangolin or some other animal. This animal might be eating the excrement accidentally, and then this animal like pangolin or cat or any animal will become sick. And if by accident, if the shopkeeper or whosoever is selling that thing, because obviously they want to sell out all their animals, they don't want to keep them beyond stacked up in their stock. So yeah, if they sell them out, this guy goes back to his home, he doesn't properly cook it up. Next thing you know is he eats that thing and he becomes sick as well. The transmission of all this thing, as I said before, is slow. It takes months. So yeah, this thing is, and as we know that the wet markets, which these places are called, have been opened since like I don't know, back in the 50s or 60s, and this thing is going on for a long time. So this whole thing, like when it happens.
So what type of animals can you find in a typical Chinese wet market?
I was looking at the list, and I was looking at the images, and you'll be surprised, you'll be shocked that you can find anything over there you can imagine, especially those animals which are rare. The reason being, the demand for these animals in China is high because some people, the elite or the people who are health conscious, they believe that these some animals, they have this I don't know, health cure or something. If you eat them, you can either live long, or if you eat them, you can live a healthy life or something like that. For they have this conception or thinking in their mind. So the thing is,
Okay, so you think that patient zero visited a wet market and that's where he got the coronavirus from?
possibility is that, yeah, that's the only.
I mean, we don't know for sure, but I'm asking for your opinion.
This is my own opinion that that's the only possible scenario we can think of, because if you saw the international news, they shut down the Wuhan market where they were selling this animals, and the Communist Party is saying that they believe that this is the hotspot, this is the place where it started from.
Okay. And China, as far as I've seen in the news, China doesn't have any local transmitted cases anymore. All the recent cases that they're having are from expats, basically, are from foreigners. So those are foreign transmitted cases. So how was China able to control the spread of the virus? I mean, you can't really say they were able to control it since it's all over the world now, but how are they able to control it within their own borders?
To be honest, you have to go a little bit back, and I might disagree with you about the fact that foreigners are to be completely blamed on this matter. I don't think so, because the diet of a,
No, no, I'm saying that the recent cases that they're having, the recent ones that they're
yeah,
having, all
they're,
of the recent cases.
they're even nowadays they are blaming the African community that they are the ones who are carrying the diseases and stuff because majority of Africans are coming back to China, so they are putting the blame on them.
Okay.
But this is like a cover up by the Communist Party. They don't want to take the complete blame on themselves because if they do that, the international media and the UNO and I mean sorry the UN and the WHO will put the blame on them. So to avoid all of that, they are putting the blame on foreigners, which I completely disagree with this, and I'm completely against this. And about this matter of the lockdown, which happened over there, I have to appreciate the fact that though that it was kind of harsh, locking down people for 50 days or more than that, which had its benefits, but according to the human rights, I think it's kind of harsh on them that you're just locking down people and on the long run because if you look at the other countries, the way they are managing it, especially where I'm living right now in the Middle East, the lockdown scenario is kind of a bit different over here. Like you get some leeway. I mean, like you have the chance to go outside and do stuff and buy stuff, but as compared to in China, my friends over there, they were telling me they were completely locked, like stuck in their own societies, in their own communities, and the only option to go, like the only option of eating or something was like ordering online, like even for buying veggies and meat and stuff and all that, you have to order online. And there were even some cases I heard that the government was saying to the municipal authorities or the local community guys that if you hear about any patient, complain to us and we will even pay you for that, which is in what happened was some people they misused it, and there were some videos which were leaked out in which people were like complaining and they were being dragged into the ambulances, and they were saying that they did the test but they are fine, and they were being forced to go to the hospital again. And yeah, it was kind of freaky. I mean, it was scary over there. So but on the long run, yeah, the lockdown worked out, but there are still some cases like coming up again and again, and it's like
Yeah, I mean, but overall, you could say that China did a very good job in managing this epidemic.
you can say up to a certain degree, yes, they did actually. If you just look,
Yeah,
if you just
I mean, if you look at Italy, if you look at Spain, if you look at USA has the highest reported death rates and the highest number of coronavirus cases and the highest daily number of deaths and case numbers.
Hmm.
Which I mean, I don't believe to a certain extent because I think China, of course, were hiding their numbers. I mean, it's not possible that China didn't have. China has less cases than Italy or Spain. I mean, I find that very hard to believe. First of all, and second of all, let's say even if the numbers are fake that China is putting out to the media. You can't deny that US is getting hit hard the most by the epidemic.
Yeah, indeed. I would like to add one more thing that there was this news about the mobile phone users in China. It's been leaked out that the number of users have been decreased a lot as compared to the statistics being mentioned by the Health Ministry of Health in China. They were saying this number of deaths have occurred, and now the number is like the curve is going down. But if you look at the mobile phone users, it's like it's like more, it's actually more than that, so meaning more people have died over there, but the news is not leaking out. And one more thing I would like to add, Numan, is that in terms of America, I think there was a huge mismanagement over there because Italy was hit the hardest, and even before Italy, Iran was hit the most. So America had a lot of time actually in their hands.
Yeah, I remember a lot of cases from Iran.
Yeah.
America did have a lot of time. Yeah, that's one of the things. That's one of the things they could have managed
Hmm.
because I mean they were seeing what was happening across the world, across Iran. I think right after China it was Iran, and then after Iran it was Italy and then
Hmm.
Spain.
Exactly.
I mean those were the major epicenters, right? And
Exactly.
then you have USA just waiting just waiting for shit to hit the just waiting for the shit to hit the fans.
Exactly.
And
Exactly.
once it did, it spread all over, right?
Exactly, yeah. And that's the thing with the Trump administration. I want to point out that I don't know if you look at the clips of Donald Trump. I think it was January, I guess, when he was saying that it's just limited to Asian community and Asian countries, or maybe he was saying it's not going to spread out that widely. So, but yeah, the administration took it like very lightly, this whole mess, and the consequences now are being faced because especially the airports in USA were not that well controlled, and they were not well regulated in terms of screening the patients of coronavirus. So people were coming in from different places and into America, and the next thing you know is that they were carrying these diseases, and they were infecting people. If America had taking this matter seriously, we would have seen a number of cases going down compared to Italy or China or Iran.
Listen, it was all over the world, man. It was bound to happen to the US. And I mean, it's my personal opinion. Again, I'm not a doctor, I'm not an expert at this, but I think more than 60 to 70% of the world's population
Hmm.
is going to be infected by the virus. Okay, will they die? Most likely not. I mean, many people will die, but as far as getting infected by the virus, I think 50 to 60% of the world population would at some point get infected by the virus. And again, I mean, there are so many people who are not just going who have the virus. They're asymptomatic, which means that they're not showing any symptoms.
Exactly.
Okay, they might be perfectly healthy, they might be exercising, they
Hmm.
might be having a good time, without realizing that they're the ones carrying the virus.
Exactly. Yeah.
It could be that grocery shop workers are carrying the virus, and anyone coming to buy their essentials, they might be contracting the virus just because this one person had it and they didn't know they had it.
Exactly. Yeah. There was actually a case, I think 2 3 days back, of sales girl, or maybe there was a girl on the customer desk, and she was complaining that the staff is not providing them gloves or hand sanitizers, and then unfortunately she passed away. And there was even a bus driver, and he made a video, and he was complaining about it, that the buses are not being cleaned properly, and there was this guy in the bus who was coughing and sneezing. So yeah, unfortunately that man also passed away.
Yeah, I mean, that's the fucked up thing, right? You're getting to see the most ugly side of the economy.
Yeah.
Like, for example, in I mean, we've both grown up in Middle East, and
Mhm.
I've heard it from so many friends that 30% of their salary has been cut, or 50% of their salaries have been cut, or they have been put on unpaid leaves.
Mm.
Some of them have been straight up fired.
Yeah, they have been. Yeah, I completely agree with you on that, and this is going to increase more and more. There was a survey going on, and they are estimating that maybe by the end of the year, maybe a lot of people, like, I'm just giving a random number, but like 80% people will lose their jobs all over the world. The businesses will go down. Small scale.
Wow, that's a very high number.
Because the thing is, as I said before in the beginning of the podcast, there is no cure, there's no treatment, and people are not going to buy stuff, especially clothes and luxury brands or luxury products. So people will be more concerned about their health. They'll be like trying to save more money in terms of medicines and food. They'll be focusing on more on that. And as you were saying also, that people are losing their jobs, so why bother going and buying something expensive or a luxury product? You might want to save that money and spend it on something on your something important like health or food. So those brands, those clothing brands, can be hit hard. And if this continues, most probably this will continue till the end of the year, then you will see, especially the small scale businesses, they will suffer a lot.
Yeah, I mean, I read, and it was a conservative estimate. So let me first start off with that anywhere between 30 to 50% of your favorite eateries, your
Hmm.
favorite cafes, hangout spots,
Hmm.
they're going to go under. They're going to go under because they won't be able to survive this pandemic.
Exactly. For me, Numan, I don't want to be racist. I don't want to be, but I completely blame. the communist.
Whenever people say that they don't want to be racist, something racist is going to come.
Exactly. Okay, it
Okay,
is.
let's hear it out, man. Let's see if we can filter this out or not.
The thing is, okay, some people are completely putting the blame on the Chinese, but I was watching these old documentaries, and they come up in the recommendations of YouTube channels, and I was completely shocked to see that it's not just China, but it's even in Muslim countries like Indonesia, where people are selling these things, and not just like selling them as a whole, but they're selling them in restaurants and in cafes, and you will find people, random people are eating that, like snake food, and I don't know, bats and all that stuff. And even in Thailand, it was like there are huge, like a lot of markets over there. So okay, if you're putting the blame completely on Chinese people that they are the ones who are spreading the disease, if that's wrong. My only issue is that why did the Chinese Communist Party try to hide this thing? What was it thinking when they were hiding this thing in last November? Because not just this one doctor, this male doctor, but there was even a female doctor who was complaining about this. And when these guys, they went to the management and they informed them, the hospital director, he told them to not to complain about this, not to discuss about it. So the next thing you know is the guy wanted to inform the public. He went on the internet and he uploaded the case file and everything. Next thing you know is the cops showed up at his home. They took him to the cell and they told him that hey, you don't have to talk about this anymore. The Communist Party, like slowly and slowly, they got to know about this. Still, they didn't inform. Then I think in January, February, they invited over the WHO guys. Then still they tried to cover it up. My issue is that, like, this is bullocks. I mean, you have a huge population living in your country, and that nowadays is a globalization era, so people, they travel frequently and easily by planes, by ships, by whatever means of transportation you can think of. So if you're trying to hide this thing, the worst case scenario is that it can spread out, and this is what happened. And
that's exactly what happened. I mean, see, normally I don't like to play the blame game because every country has its good sides, and every country has that asshole side to it. So
yeah,
as far as China is concerned, I mean, what they did here was completely irresponsible. From day one, they should have informed World Health Organization, WHO, and they should have been straight up about it. Like, listen, this is going to happen. We have people here in our country who are probably going to travel back to their countries. They might be carriers of the virus.
Exactly.
And I don't know, most people think that China is somewhat distant, but you'd be surprised to know how many people travel in and travel out of China every single day.
Exactly, yeah. If they are not just Wuhan, but there are other provinces and other cities as well, like Beijing, Shanghai, Guangzhou. People, they go and they do a lot of businesses over there. So I was completely, to be honest, I was really pissed off about this. And the funny thing also happened was, I think it was maybe in February or beginning of March, I guess, when the Communist Party, Xi Jinping, was like, "Oh, we knew about this. So if you guys knew about this, why did you hide then? And why didn't you inform the international media about it?" So I mean, it's kind of dumb to say that, like, if you knew about it, like, you understand what I'm saying, Roman? If you knew about it.
Yeah, I completely understand your point.
Yeah, if you knew about it.
I mean, yeah, see, that's one of my criticisms of the Chinese government as well. I mean, why did you have to hide this? You could have just told us that, guys, this is going to happen, get ready, prepare your shit. But they decided to go the other way. They decided to censor people who spoke up on this. They decided to hide the news. They decided to really deflate the numbers. So most people didn't even know that. Most people didn't even know that there was this huge pandemic going on in China until it spread to their countries.
Exactly, yeah. For me, Numan, okay, my issue is not that who started it actually, because China is putting the blame game on America now that, their agents, they came into China and then they released the virus over there in the labs. But think about this also. If they are saying this thing that, the agents came into their country, this means that their intelligence agency is so weak that they can't even, like, identify the people who are entering in and who are going into their labs. in the
Yeah, I mean, I find that complete bullshit, man.
exactly,
Seriously.
exactly, yeah,
Um, China has China. Listen, China has the leading technology in the world when it comes to facial recognition.
yeah,
I
exactly,
mean, they're spearheading. I mean, they're winning the game when it comes to recognition, AI, and all that.
yeah.
And I mean, you didn't have. I mean, you didn't have any protocol set up for managing this virus, managing the spread of this virus. Like, come on, man.
Exactly, no, that's what I'm saying. And that for me, I don't care about the origin. Okay, I don't want to say that okay, China was the sole responsible for this, but I'm talking about the transmission factor. Like, why did you hide the transmission of the virus? Which freaks like pisses me off, and that's my whole issue. That's my
I mean,
whole.
had they been more vigilant in letting the people know that this is coronavirus, it's a serious issue, and it's going to spread, people would have been more prepared. I mean, that's that. People would have been more prepared. They would have been like, okay, this is bound to happen.
Hmm.
Let's prepare our healthcare systems. Let's prepare our economy. Let's prepare our FMCG market, because those are the three things that have been impacted most by the virus.
Yeah, definitely is.
Yeah.
But yeah, what can we do about it now? Because I think it's too late now, and as I said before, uh, this thing is gonna last for a long time. I don't think so. It's gonna end in the summer season as well, because some countries or some people were saying that maybe the weather will change, so that we might see a drastic change. Okay, maybe the transmission, the cases will go down, but not that much because we are entering into summer season now soon. So, but if you look at Australia and
Actually, there's no evidence on it. Before we close this podcast, I just wanted to discuss, because you come from a medical background, so I just wanted to discuss a few misconceptions or a few myths that people have about the virus. See, one of the problems is the spread of misinformation. So one of the best things that people can do today is they can subscribe to coronavirus alerts directly from WHO on their WhatsApp as well as their Facebook Messenger. We'll be linking it in the description. One of the myths actually about coronavirus is that it will go away once the hot weather comes in, and that's absolutely not true, because
yeah,
if that were true, there would be no cases in the southern hemisphere,
exactly.
and there are many cases in the southern hemisphere. Australia is actually in the top 20 countries with the virus, with the total number of coronavirus affected people affected by the virus.
Yeah, indeed.
Australia is in the top 20. So, and for those who don't know, I mean, it's actually it was actually winter in Australia up until March.
Yeah,
Now they yeah, not winter, sorry, summer. Now they're having the autumn season.
I'm sorry. Yeah,
So
it's gonna be winter soon. Yeah, over
yeah,
there. My
yeah, you
bad.
agree to me. Yeah, you agree to me on a completely wrong statement. Anyway, yeah, so it was summer and now they're having autumn. So the weather there is still hot. The weather there was hot when the virus spread,
Hmm.
and the weather there was hot while there were a record number of cases in Australia.
Hmm.
So, I mean, this is a complete myth that the virus will go away. Okay, and again, I wanted to ask you a few questions, and
Yeah.
I mean, I hope you'd be able to answer them. Okay, one of the things that people are saying that you should avoid drinking cold water or ice creams or anything cold, because because if you eat something cold, you'll be more likely to get the virus. Is that true or not?
Okay, for me, I didn't hear about this, but the thing is that if you have a sore throat, then it's a possibility that, maybe there's a high chance of lung infection. As I said before, there are other many factors to include that as well. It's not necessarily that, if you're eating ice cream and then you get sick, maybe it's just a seasonal flu. So,
Okay.
for me, okay, personally, I believe that, okay, if you get sick, stay indoors, stay in your home, get the treatment by yourself. I mean, in terms of avoiding going outside unnecessarily, and if you feel that your condition is going down, call the doctors through telemedicine option, like make a video call or something, or inform them that okay, I'm not feeling well, I'm gonna come over there. So be prepared by wearing a PPE, um, instead of just barging into the hospital. Because if, for example, you just have the seasonal flu, you just have the normal flu, and you go over there and accidentally you enter into a ward or you go into the ER and people over they have the coronavirus, you're gonna get sick as well. So it's better to make a phone call before you go to the hospital, or just call your local general physician and discuss the matter with them. And maybe you never know, it's just a seasonal flu, you take the medicine, you'll be fine again. But instead of just barging into a hospital unnecessarily, it's going to create a whole mess. And once you come back from the hospital, you go back to your home, you can spread the virus in your among your family members as well. So, and I also want to add one more thing, Numan, that some countries are saying that there are some drugs like hydroxychloroquine or like antimalarial drugs.
Yeah, that's the next question I wanted to ask you. Is there a vaccine or is there a treatment for the coronavirus as of yet, as of today?
No, because I would say that Australia and some other countries as well are doing the drug testing at the moment. And Australia themselves, they were saying maybe by the end of this year, maybe they might come up with some solution. But testing takes a lot of time, because first of all, you also know very well that animal testing goes on, and even before that, you have to find the genome, the viral structure about it. So all these things, it takes time. And then when the testing begins on humans, there are like different groups being made. This thing, like, it goes through, I don't know, 3-4 phases, and then only you get one medicine out of it. And even that medicine, you cannot assure that it will have side effects or not. Maybe
Yeah, I mean, it has to go through rigorous testing and clinical trials before it can be released for the masses, right?
Exactly. Some countries are claiming that we have some people were complaining, like saying that maybe if you take the antimalarial drug, you can, there are some solutions or something has happened with them, like they're feeling better. But I would say even antimalarial drugs or the Ebola virus drug, because Ebola virus is in Africa, so it's also the drugs used for Ebola virus were consumed in Africa, and people were saying, okay, maybe they are feeling fine and they're not feeling any side effects of it, so this is the right medicine. But no, please don't do that, because as I mentioned before, every person has their own physique and metabolism. So maybe if that drug is working on you, it's not necessary that it will work on the other person. And as I said before, there are side effects as well. So there could be severe side effects to some medicines. And for example, you don't have the disease and you're consuming that medicine, it can affect your metabolism. It can affect your what do you call this? Your lungs or your heart, your organs, basically. So don't take that risk until and unless your own physician or the CDC, the WHO, the UN finalizes and say that okay, this is the right medicine. Please eat that one. But Numan has said before also that for the time being, we're not going to find any solution to this pandemic, and which is a scary thing for us. But we have to hold on, man. It's going to be tough for us in the next few months, or maybe till the end of this year. And one more thing I would like to add, in case if you're short of face mask, the CDC made a video on this, and they were saying you can use clothes to make them as face masks. Don't go panic.
Yeah, I actually saw that video. We'll link it in the description. So basically, you can make a face mask at home. You don't need to go outside. Okay, and it's very easy. And if you don't have a face mask, you can get one. You can get one made within a couple of minutes, right? I mean, it was pretty easy to make one.
Yeah, it is. And some people are also complaining that hey, Numan, that don't wear this. It's useless. It's pointless. For me, okay, personally, I believe you should cover yourself, your T-zone, meaning your T-zone is your eyes, your nose, and your lips, because these are the places where you're easily prone to infection. For example, you went to the loo, to the washroom, you didn't wash your hands properly or something, and then you accidentally, when you were outside, you touched your T-zone, so the virus can spread in easily through your nose, through your lips, and through your eyes. So from your side, what you have to do is you have to make sure that you don't make yourself infected. So it's better to cover yourself up as much as you can whenever you go outside. Okay, fine, if you're in the home, you don't need to, because you are living in a controlled environment. You know how your place is, if it's clean or not. But if you go outside, there's a high chance of getting infection, because accidentally you touch an object, or if it's someone sneezes or coughs, and that virus can stay in the air for some minutes or some hours. So it's better to cover yourself up. Even if you don't have the mask, the surgical mask or the N95 mask, use a cloth mask. Make one from your clothes. You cover yourself up. Something is better than nothing, man, I would suggest. And please, I would advise people not to go unnecessarily outside. And if among people like you are living with your family, it's better for just one person to go outside. And third, one more thing is that panic buying is not the solution. If you're stocking up, I don't know, I was seeing a video where this guy was buying stacks of Mountain Dew soft drinks.
Okay.
Yeah, but the surprising thing is that it's like the weird thing is that you're stacking up sodas. I don't know for what. I mean, like, water is more important. Keep your throat wet and stuff, but drinking all these things can make you like diabetic, and it can make you sick as well. So buying weird.
Yeah, I mean, take this time to really reflect on the important things in life. I mean, I know we're all stuck at home and it can get really boring, and some people are having a really hard time. But use this time to better yourself. To better yourself if you can. Exercise, clean up your diet, remove all the non-essentials from your life, and maybe after the virus you'll have a better outlook of life. I know it's a very dark time
Hmm.
in the world right now, but the best thing we can do is even in the darkness, we what we should try to do is stay positive,
Yeah.
because I mean, this is not going anywhere anytime soon. So keep that in mind, and the more you stay at home, okay, the better the chances of you not getting the virus. It's as simple as that. That's the basic math of it. So the best thing you can do in this situation right now is stay at home, find a new hobby, exercise, learn how to make food, learn how to learn a new skill, and if you're someone who has lost a job, try finding some work online. There are plenty of sites where you could work. Freelancer, People Per Hour, Upwork. These are a few websites where you could find some work related to your industry, or even if you can't find some work related to your industry, you could probably find something that you could do.
I just
So
want to add, I just want to add, Noman, that hey, people are listening to us. You mentioned some websites. We're not promoting them. I wish we were. I wish they were our sponsors, but for this episode, no.
no, I am promoting them. I am promoting them.
Yeah. Okay. We are.
Okay, they're not our sponsors, but
Yeah.
they're not our sponsors, but we are promoting them because. Listen, if you can find work, if you can find a way to make money, why not? Okay, and we're
Exactly.
here to
Yeah.
help you.
Indeed.
So, yeah, I mean, at the end of the day, it's a bad time for the entire humanity. So, best thing you can do is stay at home, stay positive, and look out for yourself, look out for your family. Any last words you'd like to say, Nabil?
You actually summarized very well, actually, Noman. But I would just say that yeah, stay safe. Don't go outside that much. And as Numan was saying, we don't know how long this will last. So yeah, just take care of your loved ones and wash your hands, cover yourself up, eat healthy because you are staying indoors. Not most people, even including myself, Numan, I would say that I'm not exercising that much. So yeah, it can have a toll on you, but keep a positive mind. And in terms of psychological matter, I would suggest that keep in touch with your friends and your family members. Don't isolate yourself completely, because it can take a mental toll on you. And stay positive. Learn a hobby, do something, keep your mind busy. That's the most important thing. Keep yourself busy. I know it can be tough because nobody knows how long we'll be staying indoors. We don't know how long this will last. Some people are even saying that the infection can spread again. So yeah, I mean, like, in short, I would say just keep a positive mind as well, and hope for the best. And hopefully, we all of us will come out of this, and we can continue and carry on with our lives. That's it, I would say, Naman.
Very, very well said. And on that note, we'll close this podcast. Thanks for tuning in. And since all of you guys have all the time in the world right now, why not check out our previous episodes and Give this episode a like. If you have any opinions on it, feel free to comment. And if you really liked it, please share and subscribe to our channel. And yeah, this is Alien number 1 signing out.
And alien number 2 also signing off. Thank you for listening. Bye bye.